Okay, the meeting is live. Now I'm hitting record on WebEx. So now we're recording. So now we're good there. As far as, I guess, just regular things, remember, mute yourself, not talking. That helps a lot with the background noise, etc. I explained about the recording. I've got everybody down on for roll call, so we don't need to do that. Looks like we're only missing Greg. And then I've got Stan and Jillian here as our guests. Yeah, so we should be set for that. Julia, you can take it away here for, we just have to do agenda and minutes. So I'm going to share my screen with the agenda.
Perfect.
So everyone can see it. I'm going to try. What the heck? Where did that go? Okay, maybe I'm not. Hold on. Oh, no, it's not that one. This one. Okay, can everybody see that?
Mm-hmm.
Okay, so there's our agenda, basically just our basic stuff, and then the presentation from our guests, and then any kind of comments that we would have. So, Julia, I guess I should make you, I should ask you to ask people to move the agenda.
Yes. All right. So will everyone take a look at the agenda?
I move to approve.
All right. Do we have a
Second, Tracy.
all right?
And I think we'll do for the approval, I think we'll say if anyone is opposed.
Okay, perfect. Is anybody opposed? All right, we'll move forward. And I do see that Greg is on the phone now, so.
Yep.
Right. For some reason, when I start a WebEx meeting, it causes my computer to turn off.
Yikes.
Okay. And then do we have let's look at the minutes from last meeting?
Hold on here.
Okay.
I must have not put them in the packet, so I'm going to pull them up here. All right, can you see this? Or are you looking at the agenda?
I am seeing gray.
Okay.
Same.
Let me see.
Great.
All right, let's try again here.
There you go.
There you go.
All right. Hey, it worked. Okay. Well, I got in there twice.
Do we have a motion to approve the minute?
Motion to approve.
A
Second. Perfect. Anybody opposed?
Was that Greg second?
Yes.
Okay.
Okay. Approved.
All right. So then it's our presentation here. So
Yeah.
I don't know if Philip, are you introducing it all, or do you just want to turn it over?
Yeah, I'll do a little. I'll do an introduction if you don't mind. So, all right. Well, I want to welcome our guests. Jillian Nelson is a dear friend of mine. She was my introduction to the Autism Society of Minnesota, and I've learned a great deal from her and from Robin. And I am so delighted that she has come to join us to talk about vitals, because it was because of her talking about it that I got a vitals beacon myself. And then Stan is here from the Vitals app to talk about the basics of the app, as well as the beacons and how they work and how they can be used to fit the overall health of our community. And Jillian is going to basically talk about the impact of autism and on autistic individuals when they're dealing with first responders, whether that be law enforcement or EMT. So without further ado, I'm going to let Jillian go first, and then Stan is going to follow right after. Jillian, go ahead.
Hi, folks. Thank you so much for having us here tonight. We really appreciate it. Vitals is a program that's really, really close to my heart. Like Philip mentioned, I work for the Autism Society of Minnesota. I'm the community resource and policy advocate, and I'm also an autistic adult. Within the Autism Society of Minnesota, we do a lot of work regarding interactions with law enforcement and trying to create a safer Minnesota for individuals living with autism. Within Minnesota, 1 in 44 individuals have autism. We suspect that this is not a very accurate number, because that number only looks at 8-year-old children within a certain geographic district within our state, where we know that there's a large number of individuals that are diagnosed as adults or even diagnosed later on in life. So we suspect that there's probably more than 1 in 44. But within those numbers, individuals with autism are 7 times more likely to become the victim of a crime and 12 times more likely to become involved in the criminal justice system without any criminal intent. This makes interactions with law enforcement especially challenging. Autism is a social behavioral disorder. And what that means is that people with autism experience the world differently than other people. And this isn't like a mental illness where it's a chemical imbalance. It's all about how the brain is structured and how that brain interprets the world around us. So people with autism may have higher sensory interactions with the world, like heightened sense of experiencing light or heightened sense of hearing. So sounds can be very jarring. And those things can often lead to emergency situations, which then when you bring in a first responder, you often have challenges around how do we appropriately manage that situation? How do we appropriately communicate with that? Individuals with autism are very literal thinkers. Aside from being an autistic individual myself, I work with a young man. I'm his PCA. He actually lives in your community, and he's a very literal thinker. If a police officer were to stop him and say, "Son, do you have an ID?" he'd say yes, and then he'd keep walking. He answered your question. I think someone does not. We got some mute problems. Okay, there we go. With individuals with autism is really, really vital for a successful interaction. And those are just some small examples, like the challenges of interacting in a high stress situation for someone with autism. Like I could go on and on and on for hours. In fact, we do a 4-hour training for law enforcement, explaining what those situations can look like. But none of us want to go through 4 hours of autism training tonight. So I kind of gave you the broad overview. But Vitals is a game changer. And even if a law enforcement team has autism training or other disability training, Vitals only enhances that. Because in our community, we have a saying, if you've met one person with autism, you've met one person with autism. We're all entirely different. So I'm sure Stan will show you more things, but I'm going to talk about why I carry Vitals. So I, as a person with autism, I can circumvent any stereotype about autism or any misconception about how to deal with autism by simply carrying this on my house keys. In fact, it's right there next to my CPR face shield. It's just this little teeny tiny beacon. No big deal. Most of the time, I don't even remember I have it. But anytime I come within 100 feet, 30 to 100 feet, depending on the buildings and like the waves of where I'm at, if a police officer is using the Vitals app, they get a ping. And that ping tells them that a Vitals user is within that air range. And within seconds, they can pick up their phone and they can see this. This is all of the information they need to safely interact with me. It tells them who I am, what my diagnosis is, what my de-escalation strategies are, what my behavioral triggers are, and who to contact if they need assistance or I need help outside of them, like who my support person would be. That takes that risk of a police officer not knowing how to de-escalate a situation with me from a really, really probable chance to them having every single thing they need to know. And the best part about this is it's not a pre-formatted profile where I just select something from a drop-down menu and it's one size fits all. It is exactly the information that I want in there. Tomorrow, if I didn't want the police to have any information about me, I could go in there and I could repopulate my entire profile to be nothing but a list of pasta I like. And that's my choice as a user of the app, which protects my privacy and allows me to have control over what information the law enforcement has about me, which is something that I know a lot of people with disabilities are very concerned about, is privacy and oversharing of information and making sure that the information that's being given out about them is appropriate and the information that they would choose to share. When people don't have access to information regarding autism, really, really devastating things happen. I have a good friend who has spent most of his adult life struggling with a police conviction before assaulting an officer because an officer football tackled him while he was having a meltdown. The officers didn't know he was having a meltdown because they didn't use technology like this. So he's now dealing with trauma. He's now dealing with legal ramifications of getting into a scuffle while he was in an escalated situation where he needed to be helped, not detained. I have myself had my life. I was in a meltdown situation at Mall of America, and I had police surrounding me with their hands on their tasers. In 30 seconds, I was able to hand them this app, and they was able to change them from saying that I was a person that needed the mall, needed to be protected from, to someone that needed assistance and support. Last summer, on August 31st, we lost an amazing young man named Kobe Heisler. He was shot and killed by the Brooklyn Center Police because they didn't know how to de-escalate autism, because they didn't have access to this kind of information. Knowing that autism is present isn't enough. They knew he was autistic. What they didn't have is this information. And they ended up doing the exact things that would re-escalate the situation, and they ended up shooting him and killing him. We don't want anyone else with autism to die because police don't have access to accurate information. We don't want any additional trauma because police don't have access to appropriate information. We don't want people living with anxiety or fear of moving freely within their community because they're afraid of what might happen if they have an interaction with the police while having autistic behaviors. And sometimes those behaviors are because they're escalated or something's wrong or someone needs help. Other times throughout our country, we've seen times where autistic young people will be stopped simply for having behavior, which in the community we call stimming behavior. So like flapping your hands or waving something back and forth, because that behavior looks suspicious. Police see it and they assume that the person is under the influence of drugs and alcohol. They stop. They ask questions in a communication manner that doesn't make sense to people with autism. And then it becomes a tense situation and both sides are at risk. So Vitals it's a common sense solution to take away the risk for the people with disabilities and to take away the risk for the police officers. And at the end of the day, like, I'm here to talk to you about how it helps people with autism, but it's not just autism. A good friend of mine, her husband has it because he's diabetic. So if the police find him pulled over on the side of the road, slumped over, passed out in his car, they know that's not a drunk driving problem, that he's probably having a reaction to not enough insulin. I have a friend who has it for her father who has dementia. It means that they can immediately locate him, or if someone does find him out wandering around, instead of taking 8 hours in the ER to figure out where he belongs, they're able to get him home within 8 minutes. This app is a game changer on so many levels for so many communities, not just the autism community. And in my opinion, it is, I can't think of a justifiable reason for any community in Minnesota, or truthfully throughout the whole country, to not have this. Because people like me who do have this, I'm only going to feel safer and more supported if I know that it doesn't matter what city line I cross into, that information is available and it's universal, that it doesn't matter where I go. I mean, that I am safe to travel through Edina, I'm safe to travel through Minneapolis, I'm safe to travel through St. Paul, because I'm going to have that same protection, that same information available. Does anybody have any questions?
What is the funding? Do you have to pay, or is it covered by medical insurance? How is that handled?
That is a great question for Stan.
So I just want to say thank you for having me. And this is a pleasure. I get to present with Jillian. And I knew she would do a great job. So you really don't need me. But thank you for having me. I can talk about funding. If you can give me 1 minute, I'll just introduce myself and let you know, like, I'm the Chief of Communications for Vitals. And one of the partners, we have a small team. You might have heard the name Janae Harto. She's a former police chief in Minneapolis. She's our president and CEO. We have another gentleman named Steve Mace. He's done really well as an entrepreneur. We have some officers that are in advisory mode. But I spent most of my career in public education and communications, working with superintendents and school boards. I say all that to say we understand government, we understand people. We're in a business, but we also know we're in a people business, and we're about helping change the world and making things better for folks. I normally have a presentation. I'm not going to give it because Jillian did such a great job, but I will answer questions. Funding for Vital, as far as funding goes, the model we have right now, police departments pay according to size of their departments, and it can range. I mean, right now for 6 months during COVID, we're giving the service away for free for 6 months because we understand the need right now and the uncertainty in budget. But generally, if you kind of think about $10 a month per officer, that's probably on the high side of what we're talking about. I would range somewhere between 6 to 10 depending on the department. And so that's what police departments pay. On the other side, users, it's a $4.99 a month fee, like right at $5 a month for the service. And we have these beacons that Jillian showed you, one of them. We have a couple of other form factors that you can take a look at sometimes, depending on what you want, what you need. And those range from about $20 to $30. But yet again, for the next 6 months, for a 6-month period, we're giving that service away to individuals and families too. So that's the funding model. We're approved through the state of Minnesota. So individuals and families who have the waiver, they can use that. Minnesota based. We started here. We actually launched in the summer of 17, and St. Paul was our first police department. Like Jillian said, we started off, the Autism Society of Minnesota is like a co-founding partner. They helped us learn about autism and get the service going. As we have grown and talked about this to different individuals and places, it's hard for me to even name all the different conditions or disabilities that can't see relevance. I mean, they see this being as something that's an option. The way I describe it a lot of time is if you are ever temporarily vulnerable and you can't process and you can't communicate quick enough, Vitals will do it for you. I can go in a lot of different directions of a presentation, but do you want to just ask questions now? What do you think the best way to proceed is?
Someone is typing away and we can hear everything they're typing.
Oh, that's me. Sorry.
problem. No problem. Okay.
I'm taking notes.
Okay.
I know. I'm just saying. Click,
I mean, I can keep going and give you a little bit more information too.
Yeah.
So I'm curious, Stan, you said St. Paul was the first one you started with. How many communities are utilizing it right now?
That was going to be my next statement. We have about 70 different public safety departments in Minnesota, and so it's been great. We've got the metro almost covered everywhere. We don't have now. I have to say what we don't have. We don't have Minneapolis. We don't have Edina yet, but we have just about all of them: Plymouth, Richfield, Bloomington, St. Paul, all of Dakota County. I mean, we're covering the metro, and right before COVID, we were actually really starting to expand to about 4 different states. Now we're still small, so our job in Minnesota is saturate with individuals and families. We still have a lot of work to do there, but we are really, if you live in the metro, you're going into a city that has vitals for the most part.
I'm someone that actually has it myself, but it's not activated here in Edina, so it is something that I personally am quite concerned about. And this is and for me, but for any, one of the things that I would add to this is that this is a very helpful tool for many parents with autistic children who might be very concerned about their safety should they encounter law enforcement. That sort of thing.
Sorry, Philip. I was gonna say, like, with the parents, Dan, do you want to talk about the home base feature?
Yeah, absolutely. So we're a tech company, so there are techies in the company that's always trying to grow and expand, and it's my job and the Janae's job to stop them sometimes, but they always are advancing. So they did slip Homebase by us, and it's an awesome service, and it actually enables families to have this without even having a police department in their city. And so the whole idea of Homebase is if you have a child or a parent who elopes, and what happens is if you have our technology and we can put different things on individuals, they can carry it, or they have wristbands, we have different forms that the individual can have. If that person wanders past 80 feet, it's going to alert your phone immediately and at least give you a chance to find that person. They won't go too far away. We are about 8 weeks away from launching the rest of Homebase, which is going to be called Vitals 360. What that's going to do is that's going to locate exactly where that individual went. And so we're excited about that feature. It's game-changing technology, and basically we're responding to a lot of our users. They say we need a service. But right now, if you have, and we've actually been in meetings with the Dementia Society of America, really partnering and trying to find the right beacons for people who have dementia at different levels. And so they feel like it's a game changer too, because people elope and now they can have help when that happens. That's the new feature. And Jillian was on TV, I think, showing it one time. So it works.
Yeah, right before COVID.
It's one of those things when things are brand new, it's not brand new anymore. You're like, oh gosh, I'm going to show this on TV. I hope it works.
So fun life hack for it, you guys. With my autism, I'm really bad at leaving my wallet in public places. I attach my keys to my wallet now, and I turn the Homebase beacon on. So if I leave my wallet somewhere in public, it sends me a text, which has greatly reduced my anxiety and like my stress in being out in public, because then I'm not getting an hour later realizing I don't have my wallet. So yeah, it's useful in so many different ways.
I do want to tell you a story because I'm not showing the video. I think I'm going to tell you a story about a young lady named Caitlin. And Caitlin's probably 23 now. She lives in Dakota County, Hastings area. They describe her disability as a cognitive disability. That's how they describe it. And Caitlin, she's at a level where she's actually living on her own right now. when she had an incident, she was still living with her parents. She needs some support. She needs, it's learning how to be as independent as you can. So Caitlin had a part-time job at Walmart, and she got our technology, and so she's able to drive like places that she's familiar with. If she has to veer off, it gets confusing, but there are destinations that she can drive to. Well, one Saturday evening, Caitlin was driving home from work, and on the highway that she typically takes, it was blocked off because there was a traffic fatality. And then the alternative highway that she knew, they were doing road construction on that highway. And so Caitlin was absolutely in trouble and lost and confused and very stressed. She called her mom. Her mom told her, why don't you just circle back around, park on the side, and talk to the deputies, the officers. So she did that. The only problem was earlier that night, they had a call that there were going to be 18 to 21-year-olds. There was a house party, and there was going to be a lot of drinking and driving. Be on the lookout for it. So she fit that description, and the officers started asking her questions. And, Caitlin has a cognitive disability, so she wasn't answering the questions quickly. Her voice might have sounded a little bit slurry. And so he called for backup because he was going to put her through the DWI protocol. And so he did that. The officer that showed up on the scene, before he got to the scene, right when he pulled in, he has vitals. He got a ping on his phone. And before he got out of his car, he saw that it was Caitlin. He had a little bit of information, totally changed that whole exchange. He was able to talk to her, address her by name. He was able to end up calling her mom. And that ended up being an escort home instead of an interrogation. And so that was a beautiful story. It was documented in the media. And so we feel like we have something. We have something very powerful. We had one other story, and I will tell you this story because I want to give you different conditions other than autism. We have a gentleman that he has some mental health challenges, but he has bipolar, schizophrenia, depression, PTSD. He's taken some meds. He's taken meds that make him feel suicidal sometimes. And so he lives in the Baxter, Brainerd area. They were one of the early adopters. As soon as they got on, he saw the coverage and he got signed on because he knows in advance sometimes he feels like he's going to hurt himself. And so he's like, I need this. And because he knew it, he knows it in advance, he filled out his profile like with all kinds of details, just in case if he felt like he needed it. And so lo and behold, one Saturday night, he was feeling suicidal. He called his brother. His brother called 911. The Baxter Brainerd police, they showed up to the door. Before they knocked on the door, they got a ping on their phone. And the guy's name is Jack. And they were able to, because he had his profile basically read, if I say I want to kill myself, I don't want to kill myself. Keep repeating that to me. I want to live. And then he had a, normally I show a picture, he said, talk about my wife, talk about my 2 daughters. Please keep telling me I want to live. They said about 45 minutes in, they talked to him, they de-escalated him, and it was okay. We got a message from him the next day saying, I think you guys saved my life last night. He was documented in the Star Tribune and some other places, but it's powerful. This is the most powerful work I've ever been a part of. And it's about also partnering with advocate groups, other organizations that are already kind of making life better for people with conditions and disability. That's what we really want to do. But that's my speech or conversation. Stories are great when you have them.
I think and what Sam was just talking about with that gentleman, that's the most powerful piece of this, is so many of the services that are out there for people with disabilities are people speaking for us, are people determining what we need to disclose or what needs to be shared about us. And Vitals leads everyone else in the fact that we, the families, or the individual with a disability, we are in the driver's seat. We can put as much information in there as we want, or we can put the bare minimum necessary to give them what they need. And it is entirely up to us. And that is an amazing amount of empowerment for a community that has often had things, including information shared about them, completely controlled outside of being consulted. So being able to have that is really powerful. Like Stan said, like I think I was the first person to say, Vitals is my voice when I don't have one. I am incredibly well spoken and outgoing when I'm okay, but when crisis hits, when I am dysregulated, like I go nonverbal at times. If I didn't have Vitals to show police and first responders who I am, some of those interactions could have ended very differently.
Any questions? It's new technology. Probably have questions.
This is Andrew. I have a quick question. I'm not sure, I guess, like how much information is given if like the conversations don't go the way that you hope they'd go. But do you have any ideas for like what some of the barriers are for for non-adopters, like for municipalities you've approached, and just to kind of talk it through and ask them to adopt, kind of give it's the same thing that we're doing now. Like, what's been the response in terms of if people are just kind of saying that it's not the right time for them? I mean, like what's the pushback?
Are you talking about departments or individuals and families?
I think like departments, kind of on the like by and large departments. Just what's the hesitation to adopt?
I think some departments, a few departments talk about budget, but it's not a lot of money really. I mean, when you start prioritizing, that's all about priorities. But that comes up, and then others talk about they already have other things that they think will work, but like Project Lifesaver. But if you know about that service, it's nothing like ours. So that means that's more of a not lack of information. But I would say 90+% of the conversations we have with police departments are very positive. Nobody just says we can't use this. We've talked to Edina at different moments, and I do know this, and I don't know if this is Edina or a different place, but some departments in school districts, I used to be in school districts, they're not early adopters. They want others to kind of try it out first, and then they'll get it. They'll do it. Bloomington did that. They just signed on. They were our latest sign on. And so, but we don't get any consistency. The one thing people say is budget, but we've had so many departments that they don't even blink at the price. So I don't know how much truth there is to that either.
Okay, so thank you. That's really helpful.
I can tell you that as someone that has trained, that has done the autism training, and we demonstrate this in that training, most of those objections come from the higher ups related to things like budget. Because when we pull this out in an autism law enforcement training and the police officers see this, their eyes light up like kids on Christmas Day. Like they want it. They know how much it would help them in the field. So most of those objections don't come from the actual officers and the people that would be benefiting from using it. It comes from an administrative standpoint.
Yeah.
Thank you very much.
Is any of the data retained within the city, or from a security perspective? Are there any security concerns? Sorry.
It's a great question. So what we do is we do quarterly reports, because there is data there's information that could be helpful for public safety departments, but it's all in the aggregate. We don't identify people. They have access to information. Because of the presentation, I didn't get a chance to show you. I should have, so what happens is when an officer or an individual comes within 80 feet of somebody with our technology, their phone gets alerted. Once they leave that 80-foot bubble, that information goes away. We do allow them to have access to some information for about 12 hours so they can put a report together. But it's just basic information. They don't know, they're not tracking the individual. They can't keep up with the individual. It's just that moment of time. So sometimes they want to have some information. But that's how it works. The reason why we're HIPAA compliant is because it's all voluntary. Nobody's forced to do it. This is all that you want to be empowered to give the information.
Yeah, and as a fairly independent adult, just to comment on that, I have altered my app. Like, let's say I'm going out drinking with my friends, I'll change some things on my app because that's not necessarily information that would actually apply like while I'm out being a grown adult having fun versus like if I were to be pulled over in a traffic stop. So that's one of the really great things about it being user directed is you can change that information immediately. And so like I change it for when I want less information available. But like from a parent standpoint or someone having a bad day, let's say I was having a really, really bad day and I left my house and I was in the middle of a meltdown. My partner could go into the app because I've given her my like the login information because she's the person I consider my caregiver, and she could put in there that Jillian is having a bad day because of this. She's experiencing a meltdown. This is what that looks like for her, and update it immediately so that if I were to encounter a police officer like 2 minutes later, they have up-to-date access of information of exactly what's happening with me in that exact moment. And then the next day, we can completely remove it and it's gone forever.
Jillian, you helped me. I'm sorry. Greg.
I'm sorry, I had a question. As a retired physician, I can think of several medical conditions where this would be useful. Epilepsy, diabetes, Parkinson's disease. Are you reaching out to those medical communities? For example, the Diabetes Center at Park Nicollet or the big neurology clinics to make them aware of this so that they can then offer it to the people that they encounter?
Not enough. That's an honest answer. Not enough. I will say the most successful session I've ever had so far was with the Epilepsy Foundation. They had some type of affair, and we were bombarded. There was a line because it's like a perfect thing. You have people who are really as normal as can be, and all of a sudden they're in trouble because they're having some type of episode a few times a year. So, but we need to do a lot more in that area. We're still small, but that's part of that's what we want. We started in California, and we actually started with meeting with the hospital CEO out of one of the hospitals in Northern California. So we kind of started with law enforcement here in our home state, and as we go, we're kind of experimenting. We're always going to be with law enforcement, but we started having an immediate conversation with hospitals in California. But yes, that's part of the plan.
I want to include a little something here. In the past few months since COVID-19 has occurred, they have added an option to it so that someone can say, I am at risk for COVID-19. And it becomes very useful. Is it useful for EMTs too? Is that how that works too?
Absolutely.
So that they will know that the person they're dealing with is at risk for COVID. Yes, that's what Jillian's showing you right now. So they will know they're dealing with someone who is you could potentially have the condition. So it helps EMTs to protect and law enforcement to protect themselves as well.
Yeah, underlying conditions, and that means there's a lot of people that have underlying conditions that are more susceptible if they contract COVID.
So is it saying that you are currently infectious with COVID-19, or is it saying that you have underlying conditions which make you more susceptible to COVID-19?
Yes, the latter.
Okay, thank you.
Yeah. But your question is, I mean, because this group you're not a law enforcement group. I normally, sometimes I've missed this part. So we started launching this in schools. Actually went to North Carolina and launched this in 2 school districts down there, and was in conversations with a lot of school districts here in Minnesota. Have a couple of announcements coming up in the next, hopefully, if they have school in a couple of weeks. But so the background I have in schools, we know that some of the same issues that police have, people in the schools are having it. Like just in a confined place. How can you know what's truly going on in all of these student situations. And so we would give the service to a group of people. That could be a counselor, that could be a school nurse, a principal, a dean, behavior specialist, the team of people, an IEP team, the team of people who might be like first responders. They have access to Vitals, and parents can, if they feel like it would help their child, they can sign up for Vitals. And what we've done is we've assigned the technology to that adult in the building only while they're in the building, or only when they're in the vicinity of that child. And so now, what I love about this now, if you have a student that is going through a med change, a parent can update that information on the couch, and everybody knows if they're going through a med change, that could be a tough situation. They start doing different things. And so it gives parents the ability to update what's going on with their child in real time. And let's say you have an escalation, it can bring them to the scene. Normally when I do the presentation, I show you, we do these video files or these media files where people record themselves. And if there's an escalation and an officer, or in a school situation, assistant principal cannot de-escalate, they can go into the profile, click on mom, and now she's talking to her child. And you can change that. You can change that recording all day if you want to. I mean, I have a son. I normally tell this story. I have a son that it's the toughest situation, because if you saw him, he would be as normal as can be. But when he's escalated, it is really bad. And, he would tear up classrooms, he would run out of classrooms. And it was just difficult because, he's not showing anything. And so for somebody like that, when he was going through a med change, those were the worst days, the most stressful days. And now, instead of having to email everybody and hope that somebody gets it, anybody who has my technology, I can just update in my car. He's going through a med change, and now they can be on the lookout, and maybe their behavior, their adult behavior, will change that day. Questions? Don't get me talking about school stuff.
Hey, Stan, I got a question. Can you talk about the officer training part of the program, how that works?
Yeah, so I'm glad you said that. We're not a substitute for training. And I know Autism, they do lots of trainings, and that's important. So it's great when a police department has a culture that they need to be trained. But we have simple technology. I like to joke around about this. If you are a millennial, the training's probably 10 minutes and it's insulting because it's just using an app. If you're an Xer or a baby boomer, it might take like 30 minutes because we're a little stubborn. But it is easy to use. We do have a session where we want to go over to make sure they're using all the features. But it is really easy to use, and what it's doing is just running all the time on their smartphones, and so they don't ever really have to do anything, except for when they get alerted, then they need to click on there and see what that's about, and they have the option. Once they're alerted, they have the option to click in or not. And I tell people all the time, part of the training is, if everything is normal, most of the time you might not even need to go into a profile. There's no reason. But if now you have the option, if things are escalated or if things are suspicious, now you can go in and take a peek and see what's going on.
So right now, in the Minnesota Senate and the Minnesota House, we're at a point where there is a lot of discussion about police reform. Two of the larger bills that are included, two of the larger pieces that are being agreed upon by both the House and the Senate that aren't being still debated are both training pieces. And this tool is a really, really great addition to those training, because we can give them a 4-hour training every 4 years on mental illness. We can give them a 4-hour training every 4 years on autism. And those things are hopefully going to become mandates. But this gives officers information to take the generalizations they will learn about mental illness, or the generalizations they will learn about autism, and give them the information to apply it specifically to that individual. The other piece with this, that if, let's say, something goes wrong in the session, I really hope it doesn't. You guys, I've worked on that law enforcement bill really hard. But Minnesota last session passed a law that allows individuals with a mental illness or autism to put a marker on their ID cards or their driver's license. Kind of similar, like you might have one for diabetes, or I don't even know what the other ones are, like vision impairment. So if an officer takes an ID, they automatically see that. That's not enough. And in fact, I think that puts our police departments throughout the state at a great deal of risk, because now as a state, we've said, hey, we're going to give people the right to disclose this to the police, but we're not necessarily giving police the appropriate information on what to do with that. So it kind of creates a presumed competency when the state gives people permission to disclose to the police officers that say, okay, well, now you say I can tell them, that must mean that they know what to do with that information. So I've had some concerns about that for how that's going to open up police officers to liability. Like, oh, well, the state, I disclosed on my driver's license that I was autistic, or I disclosed on my driver's license that I was bipolar, and then the police did this, and that's not how you should work with someone. So this, in my opinion, on top of protecting individuals with disabilities, this also becomes a protection for law enforcement.
Yes.
We're hearing through all of the police reform conversations about how much money is spent in the cities and in our suburbs for police misconduct or for things being handled poorly. If we give officers the exact information, then we don't have as many of those lawsuits, because now they don't have to guess. We're taking away the guesswork. We're protecting our officers. We're protecting our people. Everybody wins. And everybody goes home safe at the end of the night. And that's the most important part, right?
I just have one quick question to kind of follow up on some of the things we've been talking about around the stops and officer interactions. How it'll be bumped to their phone and they're able to see the card. Is there any ability on the officer side to? And again, I think a lot of this probably comes down to how people prefer to absorb information, or take in information. But do they have any ability to kind of to bump out like a similar card back to the individual, just so we can? I'm Officer Smith, like I'm like the one that's responding, just like some really quick stuff about them. Like I don't know if that's something that exists or has been considered or would even be helpful.
We haven't done that. We haven't gone that route. We actually were talking to some partners in the home health industry, where they have folks that knock on doors and visit people, and we were in conversations with giving them that back-to-back feedback, like where you want to know who's coming to your door. But we haven't done that with law enforcement. We haven't done that yet.
My friend has it on their profile. So it's not necessarily a feature of the app, but she has it written in her profile that her best form of communication is written communication when she's upset. And she actually asks in her profile, if possible, can you text message me?
That's awesome.
And has her cell phone number. So, I mean, and then at that point, it's like the officer's choice, but it's one of those things where you can advocate, like, this is how you can best communicate with me. And yeah, so then the officer can send a message and be like, hey, this is Officer so-and-so. I'm pulling you over because you have your headlight out. Can I see your insurance? I'm coming to your window, and then take all of the guesswork out.
One of the things that's in the app, and I forgot to tell you this because I didn't show you the photo, the picture that we normally show, is on the last field in the profile is the emergency contact information. So now you have the ability to just go ahead on and just call somebody, and an officer can call somebody and get some assistance that way. I'm sorry I didn't tell you that in the front end. There it is.
No, thank you. That's all really helpful. It was just something that I kind of thought of, just as, we talk about situations where, things can be escalated for a variety of reasons. It's just like, the more opportunities to kind of make connections, like even before the first actual interactions happen, seems advantageous. So no, it's interesting to hear that you're looking at it for the home health.
Yeah, that was, we have a lot of different agencies that we can start partnering with. In fact, I normally say at the beginning, we're partners with the Autism Society of Minnesota, Pacer Center, ARC Minnesota, those are the main ones. We have several others, but you've probably all heard of those organizations.
And I can tell you, like, from a user standpoint, like, the quickest way to de-escalate any interaction I have with law enforcement is if the first thing they say to me when they walk up to me is, "Hey, we saw your vitals profile." Like, and that's usually what happens. I swear to God, you guys, I don't hang around with law enforcement that often. Like, I don't get in trouble. I promise I'm an upstanding citizen. I know this sounds like.
Well, imagine me. I'm hanging out with law enforcement every day. Never thought that would happen. Every day. What other questions do you have?
Hey, Stan, what are some of the objections that some of the administrations would have within the city that you've heard? Is there one common thread that's a concern?
There's a common question that it's almost very predictable at this point. We've talked to so many people. There's always going to be somebody to ask about the legal part of it, the data. They always ask about data privacy, and we answer that question. And you know, nothing significant though. Like they're really blown away by this technology. I said earlier they ask about funding being a concern, but that's about it. Once in a while, there are a couple of conditions. There are a couple of conditions that they feel that might not fit. Schizophrenia has been one that people mention as maybe not a great option, but there's no frequency in that conversation either. So it's been mostly a very positive conversation. And what slows it down sometimes is if people don't feel like they have it in their budget. And then, like I said, the data privacy, but we answer that question like from the beginning, and that question there's never been a department that stopped them, because it's empowering people to give their information if they want to.
Jeff, do you know how the budgeting process works?
Sorry, my dog is coming.
Yeah, usually we have a 2-year budget like cycle, and for depending on how much of a how significant a purchase is, sometimes things can get added within that cycle if council and the administration makes that decision. If it's something that's very really significant, like you may have seen the body cameras for the PD, or like a new fire truck is going to get purchased or something, there's a plan a couple years out for that kind of thing. So it really depends on the total cost, I guess, and then the administration's willingness to just absorb that, or do we have room in the budget to absorb it, or do we need to plan for it out further?
Sure. Okay.
My concern right now is that given what we're facing with COVID-19, it's too bad that we don't already have this working. This could probably help with a lot of that when it comes to the interaction with people who could potentially get COVID-19. It's actually a shame that we don't have that working right now for that reason. It's just one of those things that we're talking about adding a little safety. We're talking about adding safety, a sense of safety for people with disabilities, with developmental disabilities, or also like families with somebody who may have dementia. We're giving them a little bit of a peace of mind. And we know the tragic stories of things that have happened. I believe we had one just recently where I think actually in our neighborhood here near Bredesen Park, where a man walked away and they did find him dead, but they didn't know for a while where he was. Now, without knowing the exact circumstances, maybe perhaps that could have helped this. But see it is that if this can provide people with disabilities or people with various conditions with an extra layer of safety and peace of mind, I think it's worth impressing upon the city council to please consider activating it. You know, we don't want to, you know, we understand the piece about money, but this is one of those things that I consider anyway a matter of community health in terms of public safety. That's how I look at that, and so that this is important. So that's my two cents left.
You guys know I think it's important. And it's 6 months for free right now. And I can promise you, like we want, I mean, I drive through Edina when I used to drive. I don't drive as much anymore. I'm home, but almost every day. So, I mean, this is part of this, we're all in the same community pretty much. So it works better when there's connected cities that have our technology. And Hennepin County, the sheriff's department, their deputies, not all of them, but a good number of them, they have it too. So it's covered that way too. Good.
Is there anything else? No. Thank you so much for presenting. It was really great.
Yeah, it's fun.
Yeah, we really appreciate it.
Thank you.
You know how to reach me if you have questions, or you have my information. Okay.
Super, thank you.
Thank you.
Thanks for having us.
Thank you
bet.
both.
Thank you so much for having us.
Okay.
Thank you.
Thanks
Thank
all.
you.
Good night, everyone.
Night.
Good night. Wow. That was good. A lot of information. I don't have the agenda up. I don't know. Does anybody have any comments on the presentation? Anything they want to talk about on that?
What do we have to do to get it on the working plan for next year? Just out of curiosity, and how do we do that? How does that work?
Sorry, I was muted and I had to find the unmute.
Yeah, I'm like, I can see you talking, Jeff, but I can't hear you.
So in the fall here, the work plan for 2021 will be developed for our commission. So it could definitely be a work plan item to, like, I guess just off the top of my head, it could be something along the lines of like the ones we have this year are like study and report on multi-unit housing and tobacco policy, or study and report on social isolation and stuff, you know, and things that different cities are doing. So it could be something like study and report on feasibility of Vitals app implementation in the city, or like it could be report and recommend on such and such and such. So it could be worded that way to provide a recommendation to city council regarding this product. Or a study of the product and like a study and report on it. So, and then that gets submitted, and then the city manager reviews it, and he would say he might tweak it or change it or whatever, but that's the process of how it works. And then that would be done next work plan cycle, which basically starts at the end of this year and then is, you know, goes through next year. So the timing of this is pretty good, because things don't go real fast. Those of you that were through the tobacco 21 stuff and the flavor ban stuff, I mean, it takes a little bit of time to get things on the work plan, to have, you know, for the commission to work through it, create a report, and then I bring that to council, and then council might direct staff to take some action, and then there's an ordinance, and, you know, there's all those steps. So
It would be interesting to talk, since we have good relationships with Richfield and Bloomington, if they are communities that are using it, or it sounds like even newly using it. That would be really interesting.
yeah, I would guess they would be the first calls that like our PD would make, or, you know, our city manager might talk to them right away.
Nice. So we will talk about it maybe more in the fall. We talk about our work plans. Does that sound like a good idea then?
Yep.
All right, great. Do we have any member comments? Anything from anybody?
Yeah, I've just something quick. I talked to Jeff before the meeting had started, and I didn't know. So I'll kind of float it to the group. I didn't. A lot's happened since. It's kind of that way with everything, I suppose. But a lot's happened since our last meeting, including now the city of Edina has the mask ordinance in place. I believe it expires on December 31st when the state, if and when the state implements one, or when they just choose to rescind it. So I didn't know if anybody had any comments on that, or if we wanted to just issue a statement from the commission, just a statement of support or anything. But I thought it was worth bringing up.
I personally like the idea of a statement of support. I think that would be appropriate.
Anybody else?
I would agree with that.
Okay. So Jeff, just in terms of the best ways to do this, is it just like a letter that we can draft and just submit, or is it just as simple as passing like a verbal affirmation right now?
I think what we could do is if anyone wants to take a kind of like what we did with the flavor ban and Greg put that report together, we could make a motion if someone is willing to make an attempt at it or something, as a general statement of support from the Community Health Commission. I think we could make a motion tonight to have that happen. I don't know if we would need, I could ask, I guess, if we need an official motion at the next meeting to approve it, or if we could, have a motion tonight to, say that you're doing it, Andrew. Motion to have Andrew draft this statement of support of the citywide masking policy from the Community Health Commission. That's pretty simple, I think.
Yep.
And I would think that would be okay.
Okay. Again, if I'm able to do that, I suppose to get it just circulated across the group and see if anybody had any comments. Can I do that by sending it to you and having you disperse it out? Or would that be something where we would just set aside some time at the next, I'm just thinking between now and the next meeting, it's at this point, who knows what's happened between now and then. So yeah, the route you describe where it gets out quicker is probably the preferable one.
Yeah. Yeah, I think if you did something, you could send it to me. I could send it out. And if anyone had any major objections, we would just not do it until the next meeting. But okay. if anyone was fine with it, we would go forward.
Okay.
So do we want to motion for Andrew to write a letter of support? Is that exactly what I'm doing?
I move that we have him do that.
All right. Do I have a second?
I'll second Dina.
All right. Is anybody opposed? Okay. So Andrew, thank you for volunteering yourself to write that.
Yep. No, I'm happy to do so. And like I said, I'll circulate it through Jeff to everybody so people get a chance to take a look at it before anything shows up publicly.
Great. Thanks.
I should point out that the last letter that we sent up has resulted in a major lawsuit against the city of Edina. So.
I will do my best to navigate that politically in a very.
I think that's why we're not having you write it, Greg.
Yeah, that'll be an interesting process to see what happens there.
Is Hennepin County on the lawsuit as well? Are they party?
Not this one.
It's
like the city and the city manager.
I don't know why they're not, because it's the same thing, but whatever. I don't ask.
I don't know. We asked the Public Health Law Center a little bit about why are they picking Edina, and our ordinance is pretty much just, hey, there's no exemptions for like tobacco shops. There's no like, we didn't include like, there's like a, this isn't the right word, but kind of like a preamble to say why we're doing this in the actual ordinance. Like our staff report and advisory communication said that, but other cities like, I think Duluth maybe, or some other cities have like a kind of some statements of why in the ordinance, which we did not include. And so they think that maybe that's, I don't know, a weaker target if you don't include those things, but we'll see what happens. It's not, the city is not planning to, you know, go away with it or anything. It's, we'll participate in the lawsuit is the message I've gotten at this point.
Okay.
It did make me wonder how all of those counties in various states were dry counties and banned the sale of alcohol. I don't recall there being any constitutional issues about that. So as a non-lawyer, it sounds like an interesting discussion.
It does sound like it's a pretty boilerplate lawsuit for them nationwide. For this, it sounds like when something comes up, the RJ Reynolds tries to get a local establishment on board, and then they use the same kind of approach each time, and it has failed many times, but they keep trying. So
Okay. Any other comments? I have something. How's the organics program going?
are you asking me or everybody else?
Yes.
Everybody? Okay. Well, I'll talk from a staff perspective first. So, I would say good.
Okay.
You know, a lot of people surprised by the lovely cart showing up at their house, if they were not, you know, didn't get any of the messaging prior. So a lot of calls about what is this? How do I do it? I don't want it, type of thing. At this point, I think it's around 10% that have been on the do not deliver or come and pick up my cart list, which out of 14,000 is probably pretty good. We're kind of moving into the stage of, I was convinced to try this and I don't like it. Now come and get my cart, or I need help or coaching, kind of phone calls rather than the initial calls. So it's kind of slightly shifting, I would say, but I think it's going pretty well.
So what's the major barrier beyond the it's ugly, I don't want to do it? It's another thing. What is the barrier when people are calling to, they've tried it, now they don't want it? What is that? Like, what's the reason? Do you guys know?
It's summertime and it's hot
I'm
and
gonna
it
say,
can be smelly.
and people have got maggots and all, all those other
Yeah,
wonderful
so did
things.
we. But
Well,
you
it's-
figure out how to deal with it
Well,
and
exactly.
you move on.
But, all things being equal, and I know that it got delayed, it would have been great if it would have started in the fall, or just not right when we got, 90-degree weather.
Yeah.
But you can't control that, so.
Yeah, I'm actually on I use the Nextdoor app. But who asked the question? Did they think ahead of time that there may be maggots at the bottom of the bin? And then the same. I think it's the same person saying I got maggots at the bottom of my bin. And of course, this is something they did not take into consideration. Things like that is things that I've heard or read.
It's a basic life cycle of a fly. I mean, I thought it was a great learning opportunity for my 7-year-old. So, and then you just have him wash it out. Yes, he washed it out and now it's fine. So,
I was surprised at how much went in. We've only had one full 2-week cycle, but that thing was a lot more full than I expected.
But
And,
it's every
So
week.
it's every week.
It's every week.
oh,
and-
sorry.
and-
Yeah.
It is.
Really,
And that's one of the,
the message we had was that it was this at the same schedule as our recycling, which is 2
no,
weeks.
it's
Oh,
every week.
Every week.
It's
Every
every
week.
week. See, and that's one thing I was going to say is I think, and I don't know the right way to do this, but the whole people need coaching, refreshing kind of why is this a good idea? Because I think a lot of people didn't really, like you said, it just showed up and they're like, what is this? And why am I supposed to do this? So the whole idea of reinforcing it, I think will be really important.
I mean, we
And how
definitely
often it
have less
comes
trash.
and all the rules and all that good stuff.
Yeah.
Well, the comments I'm hearing, and I'm in the food business, so I've been around this on the industrial side for 30 years. I mean, every restaurant has it, water treatment, sewer, all of that. But the comments in our neighborhood and around were, I didn't have a choice in this. And I think that's where some of the feathers get ruffled here is, and I don't even know the backdrop on how this all came about, but was that an option for an intro, to have the trash service offer it, or was it offered?
Yeah, the options of how to implement an organics program were discussed at length with the Energy and Environment Commission and the council and our sustainability coordinator at the time, and our recycling staff. So there were a lot of considerations about how do we meet this, because it's a mandate from Hennepin County to the cities within Hennepin County that you will have organics collection by, like, I think it's 2022 or 2021. Like, it's within the next year or two. So it's not like it was a whim on the city's behalf. So the discussion was about, okay, how do you do it in a way that's functional and kind of pays for itself, I guess, and meets your sustainability goals. And if the sustainability goals are to get the most, trash out of landfills as possible, the council went with the kind of the biggest, I shouldn't say the biggest, but the most impactful option, which is just require it, do it like recycling, have the same kind of contract structure, everything like that. So that's the option they went with. We did have considerations about, could you require the garbage haulers to offer it? But then if we did that, there would be no price control mechanism at all. The city wouldn't be involved. It might cost you $50 a month. We have no idea what it would cost. So there's, then are you getting any participation? Or we might lose trash haulers because they don't want to provide it. And then the other option, the other discussion that was talked about was, well, just let people opt in and out, or sign up when they want or whatever. And from a budgeting standpoint, as far as, like, if you don't collect revenue from households one month, but then you do the next month and then you don't when they're gone, or the predictability of budgeting for a contract, would be almost impossible. I mean, we would just be hoping that we get some subscriptions and then trying to pay for this program. So eventually, after all those considerations, the council decided we're gonna go with the kind of the all-encompassing option.
And I'll add to that, Mike, you had mentioned food industry. The restaurants are being held, like larger restaurants, to the amount of waste that they're producing too. So there's a whole Hennepin County Environment and Energy ordinance for larger places.
Oh, no. Like I said, I've been around this. I mean, most of the restaurants, and I'm talking about food production too. Food manufacturers, they just can't put potato skins and everything down the drain. So there's a filtering system that's been in place. Food going down in the sewer is not a good thing. It causes a lot of problems.
I think the other thing we need to remind people is that I remember, it's showing my age, but I remember when recycling started, and this was the same complaint. What I have to do, I have to separate, I have to sort, I have to do this. And we all had those little plastic buckets, and people didn't put them out. And now we have big bins, and I know people that have two of them because they have so much recycling. So it's just, and it takes time to adopt, and people are just, got to get used to it. At the end of the day, it's like, it's part of what we know now.
Mm-hmm. You can't please everybody. You could try, but like you can teach my kid about maggots, and that's okay. Do we have any other member comments before Jeff moves on to staff comments? Jeff, staff comments.
Not a whole lot. This week has just been a lot of masking calls. We have very observant people around town and are getting a lot of questions about, how the mayor's order applies. So I've been working through those. That's kind of what's happening. The COVID response from the Bloomington, Edina, Richfield angle, we're kind of in a bit of a weekly routine. We have a incident command meeting every Monday, and we use weekly operational periods, and our objectives are kind of the same each week. It's kind of maintain our service levels and monitor the situation. And there hasn't been a huge adjustment necessary in the last few weeks. I guess the biggest thing was the mayor making, if some of you saw the mayor's minute or saw him on TV or anything, talking about our young people around town are really experiencing an increase in cases. And for us, it's like under 21 age group is really increasing. So of course you hear rumors and stuff about why that is, and different ways that people are getting together, but the data is showing that. So he put that out and tried to address it. But that's pretty much what I have.
So Jeff, I have a question on that, because I read somewhere that Edina is one of the few cities, and I think it was Bloomington and Richfield too, so I'm assuming it's because we're together with the health commission or the health department stuff, but that Edina is one of the few communities that actually reports its own statistics. Is that true?
I guess I'm not sure what you mean, like we display our own information?
Yeah.
Okay.
Yeah, and that
Yeah,
a lot of other cities don't do that. That's what I read. And I was just wondering if that's or what you think too.
Yeah, a lot of them probably can't get it without significant effort to ask the county where they are. They have to talk to Julia about that. And because we're a community health board, and along with Bloomington, Richfield, and Minneapolis, we get our data separated out. Whereas like the rest of Hennepin County is kind of put together, and somebody would have to somehow get that data and then parse it out by city. Like say if you're in Plymouth, or actually I got a call from Rogers the other day and Minnetonka also, and they were asking, how are you getting this information?
Send them to me.
And I said, well, I have it because of our community health board status. You can call Julia. So
yeah, no, and literally just call me, because we're pulling weekly reports now for Hennepin County. I have weekly reports that we're getting that are city specific. Minnetonka was one that we did send out. And a couple of other cities have asked me directly. So Hennepin County, not to take away from this meeting, but we do have a dashboard, and it's going to be city specific. So we're working on that with some of our IT people to get that up, so you can check weekly. It's not going to be updated every day, It's just not feasible. And at one point we were talking about zip code, but we're making it city specific because that's what people tend to want. Because there are places that the zip code could be Minneapolis, St. Louis Park, and Golden Valley. So that gets a little confusing. So, but yeah, except for other people can get it. You just need to ask. We ran it a week ago on the 7th, so we'll probably run it again tomorrow.
One of the questions I've got is I know the stats for testing is okay. I don't know what it does, but what I look at is the hospitalizations and the ICU beds, because that to me is the most important. I mean, that's what we all should be looking at. I mean, I've we know so many people that have been infected with it. They're sick for a couple of days and life goes on. But there's others that end up with pneumonia. They end up in the hospital. Is that out there? Is that information out there? How many beds do we have available? How many ICU? Like it's like a hotel, vacancies.
Yeah. So there used to be on the Minnesota dashboard.
Yeah, the state dashboard has
that. Dashboard has that information. There's like 3 different sites. There's a situation update, which is what gives you, and I can share my, well, pop this out. So I can share. There's
got friends in Phoenix, and they that's what they're reporting, and they're approaching, about 80%, 85% for hospitalization, with beds. So,
yeah. So there's different sites. The main site, well, there's several. This one that I have pulled up gives you the daily update with the testing numbers and case numbers, deaths, and then this is the hospitalization and ICU rate. And then, so there's a lot of information, and this is great, but as you said, how many do we have available? And this has been an interesting graph to look at over time and see how it's been shifting downward for age brackets. There's another website, I think if you go to COVID, there's another site that lists how many are open.
Does it list how many beds? I mean, beds in
it does.
State? Okay.
Yep, I'm gonna stop sharing. I'll find it, and I can post in the chat. So there is another site that lists like we have this many in there right now. We have this much capacity open. Then a surge, we can have X amount open in the next 24 hours and X amount more in 72 hours. So that was out there. I haven't looked at it in a while because we're so far below our threshold. So we do have, the state does have that data available, and I can look up the website. I used to have it open, but
that would be great. That's what I mean, that's really the critical part.
Right. So I can actually in the chat. It's me. Yeah, it's at state. Jeff, you know you know which one I'm talking about, right?
The main dashboard page?
Well, yeah. Let me go to.
I look at the main dashboard situation update one.
Yeah.
But that one's getting longer and longer and longer all the time.
I know.
That one does have the hospitalizations, how many are hospitalized in ICU each as of that day.
This one. Yeah. So here's the dashboard. I'll put that in the chat.
That's the one I always look at. But I think you're right, Mike. Like I have a cousin that's an ER doctor, and she's like, that's what they're talking about that's what they need to look at is the ICU capacity. How full are we? Because I mean, a lot of these, like the report that I get with all the young people on the list, they show like, have they been hospitalized? Were they in the ICU?
Mhm.
Da, 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 da. And they're like, no, 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 for a lot of them. So it's probably people that initially, when we were first, like when we were really short on testing, they would have never probably been tested. So,
Well, yeah,
so
how many
those-
cases did we have in March that we didn't know about?
yeah.
Yeah, we
So
have no
some context is good. I agree with you.
Yeah, so you can pick.
Julia, if you get that website, can you send that? Can you email that?
Yeah, I had it. I had like all of them up on my computer, and then then I had to restart my computer, and I didn't save it, and I'll find it.
Okay, thanks.
Yeah.
Otherwise, that's all I have for staff comments.
Okay. Well,
When's the next meeting?
Same time, same channel in August.
Is that the 3rd?
Second
The 10th.
Monday.
10th?
10th.
August
Oh,
10th.
yeah, August 10th.
Mm-hmm. All right.
And I don't know how you all feel. Some of the, like the boards and commission discussion at the city is about, when do we start meeting in person but spaced way far apart? I am really not, I don't have any problem with doing things like this. So from my perspective, we can do virtual meetings until we absolutely have no issue getting together in person. So that's how I'm looking at it. I'm in no hurry to make everybody come to City Hall or something. So that's how I'm gonna approach it, unless you have other suggestions.
I don't think it's a good idea for the health commission to be the first ones that jump to meeting in person. I'm just gonna put that out there.
Starter didn't get hold of that one.
I
Yeah,
second.
we don't need that.
Right. This works.
Okay,
Yes.
great. Well, I guess we could look, if there's nothing else, a motion.
I move to adjourn.
All right. Anybody
Second.
opposed?
I second.
All right, second, no one opposed. Thank you, everybody.
Good night, everyone.
All
Good
right,
night.
good night.
Thanks, everybody. Have a good evening.
Next week.